we now go on to the next session. And the speaker for this session is again my dear friend, Dr. Thair Al Jumaily, currently working as a consultant interventional cardiologist at Fujairah Hospital, UAE, and is the leader of Renal Innovation Program, adjunct professor of cardiology, Raqs University for Medical and Healthy Science, UAE, PhD of cardiology from the Jordan University Hospital. He is member of the ECS and Gulf Society for Intervention, and Dr. Jai has participated in several national and international conferences. So I'll hand over the session to the chairpersons, Dr. Amitabh Sur, Dr. R K Shrivastava, and Dr. V K Bhardwaj.
At the outset, I wish to express my thankfulness to Dr. Manoria for giving me opportunity to chair this important session on C-Peptide. As we know that C-Peptide is a useful indicator of beta cell function, though it is not recommended in regular guideline for assessing diabetic patient, but may be useful in case of confusion regarding the differentiation between the type 1 and type 2 diabetes mellitus. At the same time, it may be useful in diagnosing Modi and Lada variety of diabetes also. And recent evidences suggest that low level of C-Peptide may be associated with increased microvascular complication, and high levels of C-Peptide may be indicator of insulin resistance and cardiovascular morbidity and mortality. To throw the further light on this subject, I hand over the mic to Dr. Jumaily, please. Dr. Jumaily, please.
Good afternoon. Thank you, Mr. Chairman, for this nice introduction. And before I start, I want to thank my dear friend, Professor Manoria, for inviting me for this fruitful and elegant meeting. I will start with my lecture, which is about C-Peptide, the relevance in diabetes care. We know that it is well known that C-Peptide fulfills an important function in the synthesis of insulin. We know that this is the insulin. So this is the insulin. It consists of insulin. After it cleaved, it divided into insulin and C-peptide. So after the cleavage of insulin into pancreatic beta cell, the amino acid, the 31 amino acid C-peptide secrete into the portal circulation in equimolar concentration with the insulin. This means that 1 unit of insulin with the 1 unit of C-peptide. Actually, after its discovery in 1967, it was believed that C-peptide might exert some physiological effect similar to that of the insulin, but there is no influence on the glucose or lipid metabolism could be demonstrated at that time. And at that time, they decided that C-peptide was subsequently regarded as just a waste product of insulin synthesis. But nevertheless, it was found that to be useful, as mentioned at the beginning of the lecture, that indicator of the beta cell function. And since the mid-1970s, C-peptide has been used as a surrogate marker for monitoring the course of both type 1 and type 2 diabetes and determining the effect of the intervention designed to preserve and improve residual beta cell function. So at the beginning, they just used it to monitor the development of the disease and can sometimes be used to differentiate between type 1 and type 2 diabetes. Since that time, several studies demonstrated that patients with type 1 diabetes who show some degree of remaining beta cell activity, as we know that patients with type 1 diabetes, some of them, they don't have any beta cell activity, but those who have some degree of remaining beta cell activity are considerably less prone to develop particularly microvascular complication than those who are totally C-peptide deficient. And this raised the possibility that C-peptide may exert direct effect of its own and started to be re-evaluated in the early 1990s. Since that time, a series of studies was undertaken involving administration of the C-peptide for the patient with type 1 diabetes who have no any C-peptide activity. And this approach actually showed a positive result. And it became apparent that a replacement of C-peptide in a physiological concentration resulted in significant improvement in several diabetes-induced functional abnormalities. So since that time, they started to think that C-Peptide is not only for the diagnosis or follow-up of the patient with type 2, of the patient with type 1, but also can be useful if given to the patient to improve the some of or prevent the development of some of the complication, particularly in type 1 diabetic patient. So these surprising findings promoted a renewed interest in C-peptide physiology. And during the past 15 years, a steadily increase in the number of the reports on a new aspect of C-peptide physiology have emerged. So since that time, a lot of studies have been undertaken to see the benefit of the C-peptide in these patients, particularly the patients who have deficient in C-peptide. And this information available today includes the studies of the peptides interaction with the cell membranes and its intracellular signaling properties. This is the simplify the production of the insulin. So the pancreas have beta cell, it produces proinsulin, then cleave to the insulin and C-peptide. As we know that C-peptide goes to a portal circulation, it have a longer half-life than insulin and can differentiate type 1 from type 2 diabetes, and more accurate for follow-up of the beta cell function. Now, a lot of studies have been done, particularly published in American Diabetes Association. One of these studies about the prevalence of the detectable C-peptide according to the age at diagnosis and duration of the type 1 diabetes. This was published in 2014. And in this study, they showed that C-peptide has a lot of beneficial effect on the metabolic level and can prevent the development of a lot of the complications. So the first beneficial effect of the C-peptide anti-inflammatory effect. We know that inflammation is increasingly being recognized as an important factor contributing to the vascular damage in the patient with diabetes. And actually, there is evidence indicated that hyperglycemia may precipitate an inflammatory vascular response and play a significant role in the development of endothelial dysfunction. So a patient with diabetes and microvascular complications show increased level of the several inflammatory markers compared to the patient without complications. So any patient who have diabetes, and particularly if who have microvascular complication, if you measure the inflammatory marker, you will find the inflammatory marker higher than those without the complication. And this indicates that hyperglycemia or diabetes can initiate an inflammatory response. And this slide shows that the benefit of the C-peptide, if you give the patient C-peptide, it has a lot of the benefit on inflammatory response. It can reduce a lot of the inflammatory proteins and cascades inside the body. One of these, for example, reduce the caspase 3, and this will reduce the apoptosis. It can also reduce a lot of the inflammatory markers like leukocyte endothelium interaction, leukocyte adhesion migration into the vascular wall, and proliferation and migration of the vascular smooth muscle. All these lead to the decrease in the vascular damage. In this slide shows that leukocyte adhesion. This is the control group, and this is the patient who have diabetes without injection of the C-peptide. If we give them C-peptide, and we see that the leukocyte adhesion will be reduced in comparison with the patient without C-peptide injection. And this is in the small dose, and this is after a higher dose. We see that there is a great reduction in leukocyte adhesion in comparison with the patient without C-peptide injection. Also, a lot of inflammatory marker. This is the patient with diabetes without C-peptide injection. After they give him C-peptide injection, we see a lot of reduction in this inflammatory marker. Not only this, the smooth muscle proliferation. We notice that in the patient who have diabetes without C-peptide injection, if they injected the C-peptide, there is some reduction in the smooth muscle proliferation. This indicates that C-peptide has been shown capable of antagonizing a lot of adhesion molecules expression, and it can reduce inflammatory cytokine secretions and reactive oxygen species formation in the endothelial cells and leukocyte exposed to the variety of inflammatory inside. And as the result, it can reduce a lot of inflammatory marker inside the body and reduce the development of a lot of the complication in the patient with the diabetes. This was also published in World Journal of Diabetes, and they followed the patient who have the diabetes without C-peptide, and they found that there is some pathological consequences of C-peptide deficiency in the insulin-dependent diabetes patient. So they found that there is also a lot of effect, a beneficial effect of C-peptide other than anti-inflammatory. It also have a circulatory effect. We know that endothelial dysfunction and compromised microvascular circulation are very common in the development of microvascular complication in the patient who have diabetes. And in general, in these patients, there's impaired release of the nitric oxide from the vascular endothelium, and altered blood rheology secondary to diminished erythrocyte deformability are thought to be important in impending the microcirculation diabetes. So if there is decrease in the nitric oxide and there is decrease in the RBC deformability, this can lead to the development of a lot of circulatory effect, particularly in the microcirculation in the patient who have diabetes. So both of these factors can be influenced by C-peptide. Thus, physiological concentration of the C-peptide have shown to activate and induce both endothelial nitric oxide and to elicit augmented nitric oxide release from the endothelial cells. And this is shown in this slide that C-peptide can lead to production of the sodium potassium ATPase in red blood cell and improve red cell deformability. Also, it play a major role in the production of the ATP with the calcium. This will affect the endothelial cell to produce a lot of the nitric oxide, which will cause relaxation of vascular smooth muscle and cause vasodilatation. And this is seen in these graphs that this is a patient who have diabetes and without C-peptide, they have resting blood flow, resting forearm blood flow. If they give them C-peptide, the resting forearm blood flow increase. This is a control patient, and this is the patient with diabetes without C-peptide. The exercise forearm blood flow increased after C-peptide injection. Forearm blood flow also increased after C-peptide injection. Not only this, also in myocardial blood flow. This is a control patient. This is a patient with diabetes. And after the injection of C-peptide, we see that the myocardial blood flow increased. And clearly seen in this diagram, it showed that after the infusion of the C-peptide, the capillary blood flow velocity increased in comparison with the patient who have diabetes without injection of C-peptide. This proves that the C-peptide play a major role in the improvement of the red blood cell deformability and vasodilatation and the relaxation of smooth muscle cell, so it can reduce some of the vascular complication of the diabetes. Also, C-peptide play a major role in renal function in diabetes. So we know that early signs of the diabetic kidney disease include glomerular hyperfiltration and glomerular enlargement, primarily as a result of mesangial matrix expansion and urinary albumin leakage. That's why a number of studies showed that C-peptide elicits a beneficial effect on different aspects of the diabetes-related renal dysfunction. And these effects of C-peptide in the diabetic states are different from the observed under condition of normoglycemia and represent actually in the kidney, the effect is inhibitory rather than a stimulatory influence by the peptide or renal arteriolar endothelial nitric oxide and glomerular and tubular sodium potassium ATPase. So C-peptide in renal cells, it has inhibitory effect. So it decreases endothelial nitric oxide, but this in renal cells is different from the other part of the body. It can increase the endothelial function, which will lead to the improved glomerular function, decrease glomerular hyperfiltration, decrease albumin excretion, and improve the red blood cell deformability. Also, it has an inhibitory effect on sodium potassium ATPase, which will lead to decreased excretion of sodium and increase the energy status. Together with the transcriptional effect, it can lead to amelioration of renal structural abnormalities, decrease apoptosis, and decrease mesangial expansion. Here we can see that the patient, this is done in some of an animal, that albumin excretion is high in the animal without C-peptide. After you give them C-peptide, the albumin excretion is reduced, and this showed and proved the importance of the C-peptide to improve renal function and decrease the diabetic nephropathy in the patient who have diabetes. So the in vivo animal observation and the clinical studies, particularly in type 1 diabetic patients, provide a support for the role of C-peptide in alleviating the diabetes-induced function and structural abnormalities of the kidneys, which again indicate that C-peptide play a major role in protecting the kidney from diabetic nephropathy and improvement of the damage that happened after the patient, after a long time of the diabetes. A lot of studies, again, published in multiple journals. One of them is Diabetes Research and Clinical Practice. It showed that C-peptide, the new finding and therapeutic possibilities. And also in American Journal of Physiology, they showed, they studied and they proved that there are some physiological effect and therapeutic potential of proinsulin C-peptide. And these two studies proved that the C-peptide have also effect on diabetic neuropathy. We know that diabetic peripheral neuropathy, the most common complication of the diabetes, and a lot of our patients complaining from this notorious effect. So it is manifested as a sensory loss in the extremities with severe clinical implication and potentially leading to the foot ulceration and limb amputation. Several clinical studies with C-peptide replacement in these patients show a beneficial effect on somatic and autonomic the diabetic peripheral neuropathy. This is shown in this slide that if you give the patient who have diabetes C-peptide, this will lead to an increase in the endothelial nitric oxide, which will lead to the improved renal function. It will increase the sodium potassium ATPase, which will lead to improvement in the renal function, and also to increase the neurotrophic factor, which lead to amelioration of the nerve structural abnormalities. This graph can show that nerve conduction velocity. This blue line, this is the patient who have diabetes before injection of the C-peptide. If give them C-peptide, this will lead to the improvement of the nerve conduction velocity. This is the control group. Again, the axonal disconjunction is done in the animal. This is the animal with diabetes without C-peptide. If they injected the C-peptide, this will lead to decrease in the axonal disconjunction. And again, this is the somatic nerve velocity. It increased after the C-peptide injection. This study then, it showed that after C-peptide injection, the verbal, I mean the perception receptors improved. So the patient started to have some improvement in their perception peripherally. And this summarized that the available clinical and experimental evidence demonstrated that C-peptide exert a multitude of beneficial effects on the pathogenetic mechanism underlying diabetic peripheral neuropathy, and proved that the C-peptide has a great and beneficial effect on the prevention of the development of the diabetic peripheral neuropathy. There's also some of the patients with diabetes, particularly type 1 diabetes, they may suffer from the encephalopathy. So encephalopathy is now becoming a recognized complication of diabetes. They noticed that the neurobehavioral examination of children with type 1 diabetes indicate the presence of deficit in attention, executive function, intelligence, memory, which parallel lower IQs and impaired school performance. Contrary to the earlier belief, before we thought that cognitive deficit don't seems to correlate with, we thought that cognitive deficit was related to the hypoglycemic episode. But nowadays they found that this, after using volumetric magnetic resonance imaging and voxel-based monographic analysis, revealed that significant deficit in limbic gray and white matter volumes. And the neuropathophysiology examination showed significant neuronal loss in hippocampus and frontal cortex in the type 1 diabetes, which means that the development of the encephalopathy is not related to the hypoglycemia. Actually, it's related to the diabetes itself and probably related to the deficiency of the C-peptide. So this is a study, and it showed the graphs that density of the pyramidal neurons, the control groups, and these in the animals. Animals with diabetes, after they injected the C-peptide, they noticed that there's an increase in the density of pyramidal neurons. Not only this, there is an increase in the production of the sum of the beneficial proteins inside the brain, like synaptolysine expression. This is the control, and this is the animal with diabetes, but without C-peptide. After they injected them C-peptide, there is an increase in this synaptolysine expression, has a beneficial effect, improvement of the neuronal function, and prevent the development of the encephalopathy. So the conclusion and the future future outlook. From the multifaceted effect of C-peptide, as discussed above, it should be clear that C-peptide can no longer be considered an irrelevant byproduct of insulin biosynthesis. It can affect a lot of the proteins and signals inside the body. So extensive studies in animal models of diabetes and early clinical trial in diabetic patients demonstrate that a replacement of C-peptide results in a beneficial effect on diabetes-induced functional and structural abnormalities of peripheral nerves, the kidneys, and the brain. So much remains to be learned about C-peptide. Still, we need a lot of studies, but even a cautious evaluation of the available evidence present in the plain sight the picture of the previously unrecognized endogenous peptide with therapeutic potential. So we need a lot of study to prove the benefit of the C-peptide in the clinical practice. Since no disease-modifying therapy is available for the patient with microvascular complication, particularly in type 1, diabetes, it can be hoped that ongoing development of long-acting C-peptide will facilitate further clinical trials and allow definition of C-peptide potential role in therapy of diabetes. Not only this, but we know that C-peptide have some clinical and therapeutic impact. It is more reliable than insulin as a measurement of endogenous insulin secretion, and also can be used to measure the insulin-treated patient. Measurement of C-peptide levels can be used as a means for distinguishing of type 1 from type 2 diabetes or mood. Thank you very much.
Thank you, Dr. Jumaily.
Thank you.
For the nice cover of the topic. And C-peptide is not only useful for differentiating various types of the diabetes, but also useful as a therapeutic tool for preventing microvascular complications of diabetes, including nephropathy, neuropathy, and encephalopathy and whatnot. So we'll see in the future. The future is bright so far as the C-peptide is concerned.
Yeah, you still some of the studies, actually, most of the studies done on animal. We need more studies on human. So after these studies, human, we might see in the future within the guidelines to use C-peptide in the patient, particularly in type 1 diabetes, to prevent the development of the complication, actually, before starting the development of the complication. We hope that, inshallah, in the near future.
Yeah. But at the present, it is not recommended in regular guideline for
So far, there is no guidelines to approve it. It's used to prevent the development of the complication. It needs more studies. The studies still not that supportive studies. We need more and more studies.
Yeah. Thank you very much. And so if there are no questions, I conclude the session and hand over the mic to Professor Manoria. Yeah.
So, thank you, Dr. Jumaily.
Thank you very much.
Insights from the world's best medical minds. You are watching TheRightDoctors.com.